All right. So when we go to the integumentary system, first thing we're going to talk about is the body membrane. So the term membrane is going to refer to a thin sheet-like structure that may have many important functions within the body. They will cover and protect the body surface, line your body cavities, and cover the inner surfaces of the hollow organs such as the digestive, reproductive, and respiratory passageways. There's going to be three different types of epithelial membranes. The cutaneous membrane or the skin, that's going to be the primary organ of the integumentary system. And it's going to be the largest and one of the most visible organs within the body. The serous membrane, that's going to be composed of two distinct layers. The epithelial sheet is going to be a thin layer of simple squamous epithelium, and the connective tissue will form a very thin glue-like basement membrane that folds and supports our epithelial cells. The parietal layer is going to be the layer that lines the walls of the body cavity, much like wallpaper is going to cover the walls of your rooms. And then your visceral layer is going to be the portion of the membrane that folds inward and to cover the surface of the organs within a body cavity. And then you'll see your mucous membranes. Those are going to be your epithelial membranes that contain both an epithelial layer and a fibrous connective tissue layer. These line the body surfaces that open directly to the exterior of the body, and examples of those are going to be lining the respiratory, digestive, urinary, and your reproductive tract. Unlike the epithelial membranes, the connective tissue membranes will not contain epithelial components. These membranes are going to be smooth and slick and secrete thick, colorless, lubricating fluid, and that's also known as your synovial fluid. The membrane itself is going to help reduce the friction between the opposing surfaces of the bones in our movable joints. Now, our epidermis is going to be the outermost layer of the skin. It will be a relatively thin sheet of stratified squamous epithelium. The tightly packed cells of the epidermis are going to be arranged in up to 5 distinct layers. The basal cells of the innermost layer, which is going to be the stratum germinative, that's going to attach the underlying dermis. Its cells will continuously undergo mitosis and reproduce themselves. So as new cells are produced in the deep layer of the epidermis, they're going to be pushed upwards through our additional layers. As they approach the surface, the cells will die and their cytoplasm is going to be replaced by keratin, which is going to be tough, waterproof material that provides cells in the outer layer of the skin with a horny abrasion resistance, and it's going to help protect the quality of the skin. And then that tough outermost layer of the skin is going to be called the stratum corneum. The dermis is going to be the deeper of the two primary skin layers, and it's much thicker than the dermis. So the mechanical strength of the skin is going to be within the dermis, and it's going to be composed largely of connective tissue. Unlike the epithelial cells of the epidermis, which are going to be packed together, your dermal cells are going to be separated from one another and have fibers scattered in between them. Some of the fibers are going to be tough and strong. Those are going to be known as your collagen, whereas others are going to be stretchable and elastic, and those are going to be known as your yellow fibers. The upper region or the papillary layer of the dermis is going to be characterized by parallel rows of tiny bumps called our dermal papillae. This layer of the dermis is going to be composed essentially of loose connective tissue elements within a fine network of those thin collagenous and elastic fibers. The dermal papillae is going to increase the surface area of a glue-like dermal epidermal junction, and that will help bind the skin layers to each other. The ridges on the fingers, the tips of the fingers and on the skin that covers the palms of your hands, those are going to result from the parallel arrangement of the dermal papillae underneath the epidermis. The biological function of our skin ridges is going to be to improve our grip when making or using the tools. Those friction ridges are going to help us walk upright without slipping and to make and hold again our tools. These ridges will also help us sense any textures on any surfaces within the environment. The deeper area or the reticular layer of the dermis is going to be filled with a dense network of those interlacing fibers, and most of the fibers in this area are going to be collagen fibers that make the skin tough. In addition to the connective tissues, then the dermis is going to contain an extensive network of nerves and nerve endings to help detect sensory information, such as our pain, pressure, touch, and temperature. Now, the human body is going to be covered in millions of hairs, and they'll develop early in life and are going to be present by birth and most on most parts of the skin. The hair of a newborn is extremely fine and soft, and that's called lanugo. And that's going to be coming from the Latin word meaning down. In our premature infants, the lanugo may be noticeable over more parts of the body, but soon after birth, that lanugo is going to be lost and it's replaced by new hair that's going to be stronger and more pigmented. Hair is going to be mostly visible on the scalp, eyelids, and eyebrows. And then the coarse hair that first appears in the pubic and axillary regions at the time of puberty is going to develop as a response to the secretion of our hormones. Cells of the epidermal layer of the skin are going to grow down into the dermis to form a small tube called the hair follicle. And then the visible part of that hair that's going to be known as the shaft. Hair growth will begin from a small bump called hair papilla, which is going to be located at the base of the follicle. As long as growth cells in the papilla of the hair follicle remain alive, then new hair can replace any that is cut or plucked. Contrary to popular belief, frequent cutting or shaving is make your hair grow faster or become coarser. A smooth, tiny, involuntary muscle can be seen at the follicle, and that's going to be known as the erector pili muscle. It's going to be attached to the base of the dermal papilla above and down to the side of a hair follicle below. Generally, these muscles will contract only when we are frightened or cold, and that's going to be known as the erector pili, which is Latin for erectors of the hair. Nails are going to be classified as our accessory organs of the skin, and they're going to be produced by cells within the epidermis. They're going to develop when epidermal cells over the terminal ends of the fingers and toes will fill with keratin and become hard and plate-like. The visible part of the nail, that's known as the nail body, and then the rest of the nail or the root lies in a groove and is hidden by a fold of skin called the cuticle. The nail body nearest to the root does have a crescent-shaped white area known as the lamella. Receptors in the skin will make it possible for the body surface to act as a sense organ, and it will relay messages to the brain concerning sensations such as our touch, pain, temperature, and pressure. The two skin receptors are going to be the lamellar corpuscle, which will detect our pressures deep in the dermis, and then the tactile corpuscle, which detects our light touch. Other receptors will mediate sensations such as crude touch, vibration, temperature, and pain. The skin gland is going to include two varieties of sweat glands and tiny sebaceous glands. Our sweat glands, also called the sudoriferous glands, those are going to be the most numerous of the sweat glands. They can be classified into two different groups, your eccrine and your apocrine. And those are going to be based on the type of secretion and the location. The eccrine sweat glands are going to by far be the more numerous, important, and widespread sweat glands throughout the body. They're going to be small and are going to be distributed all over the total body surface. Throughout life, they will produce a transparent, watery liquid called perspiration or sweat. And then those apocrine sweat glands are going to be found primarily in the skin in the axilla or the armpit area and the pigmented skin around the genitals. They are going to be larger than the eccrine glands, and instead of watery sweat, they will secrete a thicker secretion. The odor that's associated with those apocrine sweat glands, then that's not going to be caused by the secretion itself, but instead it's going to be caused by the contamination and decomposition of the secretion by that skin bacteria. Our sebaceous glands are going to secrete oil for the hair and the skin. Therefore, they're going to grow where the hair grows. The tiny air duct or the tiny ducts that will open into the hair follicles for their secretion, which is called sebum, that will lubricate the hair and the skin. Your sebum secretion is going to increase during adolescence. It's going to be stimulated by the increasing blood levels of sex hormones, and then it will decrease in late adulthood, contributing to increased wrinkling and then cracking of the skin. The skin's going to serve as a number of important functions that contribute to our survival. The skin as a whole is described as our first line of defense against a multitude of hazards. It's going to protect our body against the daily invasion of microbes. It will also play a key role in regulating our body temperature regulation. And it accomplishes this by our sweat secretion and alterations in our blood flow through the blood vessels close to the body. When sweat evaporates from the body surface, then our heat is also going to be lost. So the principle of heat loss through evaporation is basic to many cooling systems. Our skin will function also as an enormous sense organ. It's millions of nerve endings that will serve as antennas or receivers of the body, will keep it informed of changes within its environment. The term excretion, that's going to refer to any process in which the body rids itself of waste or surplus of substances. And then the excretion of substances in sweat can influence the amount of certain ions, such as our sodium, as well as any waste products such as uric acid, ammonia, and urea that are going to be present within the blood. Excess vitamins, drugs, and even hormones in the blood can also be secreted into the skin by our sweat. Synthesis of vitamin D is going to be another important function of the skin, and it is going to occur when the skin is exposed to UV light, typically in or from the sun. When this occurs, you're going to have a precursor substance in the skin cells that's transported to the liver and the kidneys, and then from there, it's going to be converted into an active form of vitamin D. The three most common types of skin cancer are going to be squamous cell carcinoma, basal cell carcinoma, and our melanoma. So our squamous cell carcinoma is a slow-growing malignant tumor of the epidermis, and then lesions typical of this form of skin cancer will begin as a hard raised nodule that is typically painless. If it is not treated, then it will grow in size and eventually metastasize, invading other organs and areas of the body. Our basal cell carcinoma, that's going to be the most common type of skin cancer, and it's typically going to appear on the face. It often first appears as a small raised lesion that erodes in the center to form a bleeding crusted cater. Melanoma is going to be the most serious form of skin cancer. And then this type of skin cancer can sometimes develop from a benign pigmented mole, and then it'll transform into a dark, spreading cancerous lesion. The benign moles should be checked regularly for warning signs of melanoma because any early detection and removal are going to be essential for treatment. And then lastly, Kaposi sarcoma, that's going to be caused by the Kaposi sarcoma associated herpes virus, also known as KSHV. And it was once associated mainly with certain ethnic groups. A form of this cancer also now appears in many cases of immune deficiency. The Kaposi sarcoma will first appear as purple papules, and then it quickly spreads to the lymph nodes and internal organs. Burns are going to constitute one of the most serious and frequent problems that will affect our skin. So typically we think of a burn as an injury that's caused by the fire or contact of the skin within a hot surface. However, you can have overexposure to UV light, which would result in a sunburn, or contact of the skin with an electrical current or a harmful chemical, such as an acid, and those can also cause our burns. The classification and seriousness of a burn injury, as well as the appropriate treatment and possibility of recovery, those are going to be determined by three main factors. You have your total body surface area, or the TBSA, the depth and number of tissue layers that are involved, and then the type of homeostatic mechanisms that are disrupted. So, was the respiratory or blood pressure controlled, and fluid and electrical and electrolyte balances? When burns involve large areas of the skin, treatment and recovery will largely depend on the TBSA and the severity of the burn. The rule of nines is going to be one of the most commonly used methods of determining the extent of a burn injury within your adult. With this technique, the body is divided into 11 areas of 9% each, with the area around the genitals representing the additional 1% of your body area. So your classification system used to describe the severity of burns is going to be based on the number of tissue layers involved. The most severe burns will destroy not only layers of the subcutaneous tissue, but also your underlying tissue. Your first degree burns are going to cause minor discomfort and some reddening of the skin. Although some of the surface layers of the epidermis may peel in 1 to 3 days, there is not going to be any blistering occurs and actual tissue destruction is minimal. Your second degree burns will involve the deep epidermal layers and it will always cause injury to the upper layers of the dermis. Although deep second degree burns will damage sweat glands and hair follicles, as well as your sebaceous glands, this complete destruction of the dermis is not going to occur. Blisters, severe pain, general swelling, and fluid loss will characterize this type of burn, and scarring will be common. Now, your third degree burns are going to be characterized by complete destruction of the epidermis and the dermis. And in addition, the tissue death extends below the primary skin layers into the subcutaneous tissue. Your third degree burns will often involve underlying muscles and even bone. And one distinction between second and third degree burns is that third degree burns are insensitive to pain immediately after the injury. And that's because of the destruction of the nerve ending. However, the pain will occur soon after the injury. So the fluid loss that results from our third degree burn is typically a very serious problem. And then another problem that comes with third degree burns is going to be the risk of infection because those protective functions of the skin will have been lost. And then your fourth degree burns, those will extend below the subcutaneous tissue to reach muscle or bone. Such injuries will occur as a result of high voltage high voltage electrical burns from exposure to very intense heat over time. So treatment may require extensive grafting, and then sometimes it can even occur or result in the amputation of your limbs. Pressure ulcers are going to be necrotic skin lesions that appear where the body rests on the skin that covers bony projections, such as the sacrum, the heel, elbow, ischial bone of the pelvis, or the greater trochanter of the femur. So the pressure interrupts the circulation, leading to thrombosis, ulceration, and tissue death, also known as necrosis. Poor general health, malnutrition, age, obesity, and infection will contribute to the development of those pressure ulcers. Pressure ulcer lesions will first appear as redness of the skin. If ignored, then they may penetrate the skin and underlying muscle, extending even to the bone, and then some may require months to heal. Pads and mattresses to relieve pressure, regular cleansing and drying of the skin, frequent change in position, and good nutrition will help to prevent our pressure ulcers. Some other terms for pressure ulcers could be the decubitus ulcer or bed sores. Both of these terms refer lying down in the bed, although pressure ulcers may appear to anyone with limited movement and not only to those who are confined to your bed. So wounds are typically going to be caused by trauma. They may affect not only the injured area, but they can also affect other body systems. Infection and hemorrhage may complicate wounds, as well as dehiscence, which is a disruption of those wound layers, and evisceration, which is a protrusion of internal organs through the lesions. As wounds heal, fluid and cells will drain from the damaged tissue, And then that drainage, also known as exudate, can be clear, bloody, or it can even contain pus. Proper wound healing is going to depend on cleanliness and care of that lesion, and also on proper circulation, good general health, and good nutrition. Healing of a wound is going to be accompanied by cicatrization, which is a scar formation. Permanent scarring is going to be lessened by appropriate wound care, but some people may tend to form keloids because of excess collagen that's found during their healing phase. Various types of dressings are going to be used to protect wounded areas and promote healing. So healing can be promoted by debridement, which is the removal of the dead or damaged tissue that is found within a wound. Debridement can also be accompanied by cutting or scrubbing away the dead tissue or by means of enzymes. And a thick, dark crust or scab may be removed, is known as an aspirotomy. Grafts can be full thickness. They can either be done full thickness skin grafts or split thickness skin grafts. And then the skin is going to be grafted or cut with a dermatome. Now, I've already talked about those pressure ulcers, but again, they're going to be those necrotic skin lesions that appear where the body rests on skin that is covered by bony projections, and they will typically occur around the sacrum, the heel, the elbow, the ischial bone of the pelvis, or the greater trochanter. Dermatitis is going to be a general form for inflammation of the skin, and that can be acute or chronic. Your mild forms are going to show erythema or redness and pruritus or itching. But the condition itself may worsen to include deeper lesions and secondary bacterial infections. You have a chronic allergic form of this disorder that will appear early in childhood called atopic dermatitis or eczema. And although its exact cause is unknown, your atopic dermatitis is made worse by allergies, infection, temperature extremities, and skin irritants. Contact dermatitis, that's going to be caused by allergens or chemical irritants. Seborrheic dermatitis, that's going to be inflammation that involves the sebaceous glands around the scalp and the face. And then stasis dermatitis, that's going to be a result of poor circulation. And then psoriasis is going to be a chronic overgrowth of the epidermis, and that's going to produce large basically large red plaques with silvery scales. Sorry, my brain is not wanting to like form or pronounce that the medical term for it. The cause is going to be unknown, but there's going to be sometimes a hereditary pattern, and then also autoimmunity may be involved. There's going to be many treatments that are available, and then our dermatologist will determine the best course of treatment depending on a patient's severity. And then our autoimmune disorders of the skin are going to be diagnosed by biopsy of the lesions and our antibody studies. Pemphigus is going to be characterized by the formation of blisters in the skin and our mucous membranes that's caused by separation of epidermal cells from our underlying layers. Rupture of these lesions will leave deeper skin areas unprotected from infection and fluid loss. Lupus erythematosus is going to be a chronic inflammatory autoimmune disease of connective tissue. And the more widespread the disease, the systemic lupus erythematosus, or SLE, involves skin and other organs. It's going to be more prevalent in women than in men, and it also has higher incidences among Asians and Blacks than other populations. Scleroderma is going to be a disease of unknown cause that involves thickening and tightening of the skin. So there's going to be gradual fibrosis of the dermis because of collagen overproduction. Your sweat glands and your hair follicles will also be involved, and symptoms will first appear on the forearms and around the mouth. Your internal organs will come involved in a diffuse form of scleroderma, and it's going to be known as your progressive systemic sclerosis or PSS. And then lastly, we really only have a couple of word roots that are particularly like directly related to the skin and the associated structures. So your dermo or your dermato is going to mean that it's going to mean skin. So a dermabrasion is going to be that surgical procedure that's used to resurface the skin and then remove those imperfections. Kerato is going to be your keratin. So something that is keratinous is going to just contain the keratin. Melano is going to be dark, black, or melanin. Hydro is going to be particular to your sweat or perspiration. So anhidrosis is going to be the absence of sweating. Sebo is going to be for the sebum, or the sebaceous glands. So if you have seborrhea, then that's just going to be an excess flow of sebum. Tricho is going to be for hair. So trichomycosis is just going to represent the fungal infection of the hair. And then onycho is going to be for the nails. So onychia is going to be an inflammation of the nail as well as the nail bed.